All right, today we are going to move beyond just the DSM checklist. We're going to get into a more dynamic, real-world way of understanding bipolar disorder. I'm going to walk you through a clinical framework that will totally change how you see the illness, not just as it is today, but how it all started and, maybe more importantly, where it's likely headed. So let's dive right in.
First things first, let's tackle a question that I know every single clinician has faced. You've got a patient in front of you, and it looks for all the world like classic depression. You start treatment, but something's just not quite right. So why is it that bipolar disorder, one of the most foundational conditions in our field, so often flies under the radar, sometimes for years?
And here it is. This is the absolute crucial point. For most patients, the thing that brings them into your office isn't some dramatic, full-blown manic episode. Nope, it's depression. They come in with low energy, low mood, they can't feel pleasure, they look exactly like someone with unipolar depression. And this one simple fact is the #1 reason for misdiagnosis.
So if that initial presentation can be so misleading, how do we ever get to the right diagnosis? Well, the answer is that we have to look deeper. We have to adopt a multi-dimensional view that really captures the entire story of the illness.
This right here represents a fundamental shift in how we think. It's really a call to action. Instead of just checking off boxes for the episode that's right in front of us, we need to become, historians, pattern finders for our patients. This is exactly how we move from just slapping on a label to truly understanding what's going on. And this is our map for doing just that, the 7 Dimensions framework. I want you to think of these as 7 chapters in your patient's story. We've got prodrome, age of onset, the index episode, course of illness, polarity, cycling, and finally, treatment response. When you put them all together, they create this incredibly rich, longitudinal picture of the disorder.
Okay, so let's start with the first 4 dimensions. These are all about looking back. They help us understand the origins and the entire history of the illness, and they often reveal clues that were missed years ago. Dimension 1 is the prodrome. Now this is that subtle, often really confusing period before the illness fully declares itself. We're looking for the shadows before the storm, you could say, and it requires some careful, patient history-taking. You've got to ask about their adolescence and their young adult years in detail.
So what exactly are we looking for? Well, you want to ask about things like persistent changes in sleep without a clear cause, or maybe significant mood swings compared to their friends. It's also so key to probe for those subtle hypomanic traits, those periods of intense creativity or confidence, but also needing less sleep. Pervasive anxiety and a cyclothemic temperament are also major red flags here.
Next up, Dimension 2, age of onset. This one is such a powerful predictor. An onset in adolescence or early adulthood, and especially a childhood onset, is often tied to a more severe and complicated course of illness. We're talking more episodes and greater functional impairment down the line.
And that leads us right into Dimension 3, the index episode. This is a critical piece of the puzzle. What did that very first episode actually look like? Was it depression? Mania? Or maybe something in between? The answer tells you a whole lot.
This chart really spells out the diagnostic challenge, doesn't it? A depressive onset, that's the most common path, but it's the one that can lead us astray for so long. A manic onset is loud and clear. It's pretty hard to miss, and it usually gets a diagnosis much faster. But what I really want you to pay attention to is that mixed features onset. That dysphoric, agitated kind of mania, that is a major red flag for a more difficult course ahead.
Dimension 4 takes us from that first episode to the big picture, the course of illness. Here, we're zooming out. We're looking at the entire movie of the patient's life, not just a single snapshot. How have the episodes patterned out over the years? And what happens in between them?
Early on, a lot of patients have a pretty classic episodic course, with distinct episodes and then full recovery in between. But for some, especially if they're not getting effective treatment, we start to see the shift to a deteriorating course. The episodes get closer together, symptoms linger, and they just never quite get back to their baseline. This is really the concept of kindling in action, where each episode makes the brain more vulnerable to the next one.
Okay, let's shift gears now to the next set of dimensions. These are less about the deep past and more about the repeating patterns we can actually see in the present, which is what directly tells us how to manage the illness going forward. So, Dimension 5 is the polarity pattern. Is this person's illness mostly driven by depression, or is it mania? And what's the typical sequence of their episodes? This helps you understand the unique flavor or the signature of their specific bipolar disorder.
So here are a few of the common patterns you'll see. The classic sequence is often depression, which then flips into mania, and then back to wellness or maybe another depression. Some folks, especially those with an earlier onset, might actually start with mania. And then, a lot of patients will have an illness that's heavily weighted toward one pole or the other. Recognizing this helps you anticipate and treat their most vulnerable state.
Dimension 6 brings us to the cycling pattern. This one is all about the rhythm and the tempo of the illness. How fast are the episodes coming, and is there any kind of predictable pattern to them?
A patient with rapid cycling, that's 4 or more episodes a year, presents a huge treatment challenge. Ultradadian cycling, where their mood shifts within a single day, can often be mistaken for something like a personality disorder, but it's really a sign of severe mood dysregulation. And please, don't forget to ask about a seasonal pattern. It can be a powerful clue and a great opportunity for proactive treatment.
And finally, we have Dimension 7, treatment response. This is clinical gold. Seriously, a careful history of what's been tried, what's worked, what's failed, and what side effects were just intolerable. That is one of the most important guides we have. And this also includes adherence, because let's be honest, the best medication in the world doesn't work if the patient can't or won't take it.
So now we have our 7 dimensions. The real power here comes when we weave them all together. This framework isn't just a way to describe things, it's a predictive tool. It lets us move from just a simple diagnosis to actual clinical foresight.
This right here is where it all comes together in a super practical guide. On the left, you've got the features of a more favorable prognosis, things like a later onset and full recovery between episodes. And on the right, you have the red flags, the early onset, those mixed episodes we talked about, rapid cycling, comorbid substance use. This synthesis of our 7-dimension history gives us a much, much clearer sense of the likely road ahead for our patient.
And this is the bottom line. This whole approach lets you see the person and their unique illness, not just a label from a book. It allows for a more personalized, more proactive, and ultimately a more effective approach to treatment, which at the end of the day is what we all want for our patients. So I'll leave you with this question. How will this framework change your next case? The very next time you see a patient with a mood disorder, I want you to try thinking in these 7 dimensions. Go beyond the current episode. Ask about the prodrome, the index episode, the course over time. I guarantee it will change how you see the case and, more importantly, how you care for your patient.